top universities in the country in 2007. Duke University did a study, and they were trying to find out what is a major cause of death around the world. Why do people die? Okay? So they came and they did this study, and they came up with this answer. And it's the reason that I do my talks. Okay? Who wants to guess what the major cause of death around the world is? Anybody know? You're laughing. You probably do, Roger.
Sin.
Well, it's close. That's really close. It's close to that. It starts with the same letter.
I thought it was stupidity.
Stupidity. That was a reason. Stupidity. They found that bad personal choices are the main reason that people die early. Okay? That they die early. And so one of the reasons I do these talks is to help you make better choices. I would almost rather have you in pain and educated rather than have you out of pain and stupid. Okay? Because when you're educated, you can make better choices and get out of pain. Okay? So that's why I do these talks. All right? So tonight the talk is on the science behind chiropractic. So I'm going to ask you a question. What is science? And we throw that word around a lot, but what do we mean by that? What is it?
Science is just the result of using the scientific method.
Which is?
You create a hypothesis, you test that, and specifically try to disprove it. And then if you aren't able to disprove it, then it's more likely to be correct.
Yeah, that's exactly right. So science is about testing theories and hypotheses and finding out whether they're right. And the key word is testing, okay? Now, are there things that we've been told that we've grabbed onto, or are there things that we do that we've been educated about that aren't scientific? Okay, yeah, like, can you give me an example? I can think of examples.
Taking an aspirin will keep you from getting heart disease.
Yeah, that's one. That was never proven. That was a consensus view of a bunch of cardiologists got together and decided that. Okay? Here's another one. I'll ask you, can you think of another one?
About eating low fat. When
Oh, yeah, that's the one I was thinking, the low fat diet.
I am reading Eat Fat, Get Thin right now, so that's why that was top of my brain. I've been listening to it most of the day, so.
Yeah, the low fat diet. We were told that if you ate fat, you'd get fat. And nobody ever tested that. That was never tested. And when they finally tested it, did research, they found out that you eat fat to get thin, okay? Now, I won't go into why that is. We do that on other talks. But, yeah, I was hoping somebody would say that, the low-fat diet. I'm going to give you one more, okay? And this isn't totally unscientific, but there is an unscientific aspect to it. The overprescription of antibiotics. Now, antibiotics, it's science that they kill germs, okay? I mean, when Louis Pasteur discovered that this mold kept bacteria away, which is interesting because it was a mold that actually kept the bacteria from reproducing. That was scientific. He looked at that. He did some research on it. The problem and I think he realized this later on just by reading some of the things he said, is that the overprescription of antibiotics has led to autoimmune disease. In fact, you can track autoimmune disease by the prescription practices of antibiotics. Okay, so antibiotics have been a good thing. They've saved a lot of lives, and that part was scientific. The unscientific part was that we could just wholesale throw it at people, and nothing bad would ever happen. And now we have autoimmune disease, which is in some ways an indirect result of too many antibiotics prescribed. So science, what I'm saying is this, not everything that we're told is science is scientific. And so how many of you ever heard that chiropractic wasn't scientific? That was just quackery, right? You heard that, right? Those are people saying that, who's never investigated chiropractic. So what we're going to look at tonight is we're going to look at what are some of the studies that have been done that validate or that have actually been done on chiropractic scientifically. So we're going to go back to 1921. Here, Henry Windsor was a medical doctor in Philadelphia. And he was intrigued. He saw that people going to chiropractors were getting better. So he wanted to find out why. So he started doing autopsies on both animals and cats. And he found a total of 221 diseased organs on these animals. And what he found was there's a nearly 100% correlation between the minor curves of the spine and the diseased organs. So if there's a minor curve in the spine, you could almost bet that there were going to be diseased organs. And what he found was this, and we don't have to go through all of this in detail, but for example, if you look at the upper thoracic area, which is this area right up here, you found diseases of the heart. All 20 cases had the upper 5 thoracics involved, heart disease. Lungs, of 26 lung diseases, the upper thoracic was involved. Stomach, all 9 stomach diseases had mid-thoracic involvement, and so on and so forth. And what he found is you went down the spine and you looked at the curves in the spine and the disease processes in the spine, that they all correlated to diseased organs. And he said it was rare to find an organ which was not supplied by the same sympathetic nerves as a vertebra by the curve. And many of the organs showed acute disease while the vertebra were degenerated. In other words, what happened was the vertebra degenerated first and then produced disease in the organs, but the older the spine got, the older the person got. And he says disease appeared to precede old age and then to cause it. So the spine becomes stiff and old age follows. So therefore, we can say a man is as old as his spine. Come on in, Patty. There's a seat right there. So this study was published in 1921 in the Medical Times Journal. Okay, let's look at some recent studies. This is a University of Iowa study 4 years ago. Demonstrated the following with seniors under chiropractic care. They had fewer functional limitations, less difficulty in engaging in activities such as lifting and walking, and a lower number of doctor visits and hospitalizations. So this study concluded that chiropractic had a protective effect, safeguarding seniors against physical deterioration. Oops. What about chiropractic in pregnancy? This is really interesting. These are 3 studies that were done, and they looked at pregnant women. And one of the things they found in these 3 studies is that pregnant women with back pain do a whole lot better pain-wise if they go to a chiropractor. 1 week into treatment, 52% noticed a reduction in pain. 1 month, 70% noticed a reduction in pain. And 2 other studies on chiropractic and pregnancy revealed that pregnant women under chiropractic care had half the delivery time compared to women with no chiropractic. Now, why do you think that is? Why would a pregnant woman have half the delivery time as compared to a woman that was not under chiropractic? Why is that? Anybody?
It'd be the mobility of the pelvis, probably, right?
That'd be one thing. Yeah, the pelvic area is more mobile. So the pelvic area can spread apart when the baby's ready to be delivered. But here's another one. What controls that? It's the nerve supply. You have a nerve supply that comes out of the lower back and the sacrum that controls the pelvic muscles, pelvic musculature. And so if that nerve supply is interfered with, that pelvis cannot function as well. So pregnant women do a lot better under chiropractic care. Here's the Annals of Internal Medicine. This is 192 patients with back-related leg pain. Half were given chiropractic care with home exercises and advice. Half were given only exercises with advice. The chiropractic patients were given 20 visits over 12 weeks. At 12 weeks, the chiropractic group had less pain, less disability, better overall improvement in patient satisfaction. At 1 year, the patients who received chiropractic maintained their overall improvement in satisfaction. This is Annals of Internal Medicine, which is JAMA Internal Medicine now. It's a very well-known and respected medical journal, and I use it a lot for looking for articles in my radio show. Here's 2 recent studies in Canada, and the other in Tennessee, showed that on average, chiropractic care was 40% less costly than medical care, and patients were much more satisfied, 61% versus 27%. Here's a study from Dartmouth University on the safety of chiropractic for older people, found that of people over 66 who received chiropractic care, 76% had a lower rate of injury within 7 days of treatment compared to those who saw a medical doctor. Here's the Archives of Physical Medicine and Rehabilitation. This is looking at men with degenerative disc disease. Half were treated with chiropractic, half were treated with a fake adjustment. Results from the patient who received a single adjustment: less pain, more spinal mobility, better hip flexion, and had a significant measurable increase in height. And I have all of these studies here in my office. They're all in a bound notebook that you can look through. Here's chiropractic in the workplace. Here's 2 studies in the Journal of Occupational and Environmental Medicine. Showed 17% of workers have absenteeism on a regular basis as a result of musculoskeletal conditions. Chiropractic care offered on-site at the workplace showed improvement in both pain and functional status, lowering of overall health costs. The workers had less doctor visits, and by golly, they used fewer drugs. Okay? So, and they were more productive. And you'd think, I've run into people. I ran into a woman at a company here in town. In fact, I'll tell you, the company is Zoetis. She was the HR person in terms of health. She was a nurse practitioner, and I said, why don't companies hire chiropractors? And because she'd read these studies, why don't they hire chiropractors and have them on site then, if this is true? And she says the reason is because of OSHA. Because if you have somebody that gets hurt on the job, and they go to a primary care doctor, which is a physician, an osteopath, or a chiropractor, they have to report that to the government. And if you get too many of those, OSHA sweeps in and fines you and causes all kinds of problems. She said that's why companies don't do this, because of the reporting. That's crazy, but that's welcome to the U.S. government. Okay.
He talks a lot about that in the Eat Fat Get Thin book about how the government got involved.
Well, I know as a farmer, you probably dealt with them too, haven't you? Yeah, I imagine you have. Cervical disc herniation and neck pain radiating to the arm. This study included 50 patients with confirmed cervical disc herniation who were treated with chiropractic. Patients in this study had neck pain with moderate to severe arm pain. Patients were given chiropractic adjustments at 2 to 4 visits a week until pain-free. And that's about what you need to do, 2 to 4 visits a week. That's a very good schedule of care. At 2 visits a week, at 2 weeks, 53% were improved. At 4 weeks, almost 69%. At 3 months, almost 86% were significantly improved. And it said spinal manipulative therapy was 2 to 3 times superior to patients who had cervical nerve blocks and steroids. Okay. Now, I'm not totally 100% against steroids 100% of the time, but I think we ought to try chiropractic first before we do steroids. Now, so we talked about musculoskeletal pain so far. But does chiropractic affect your biochemistry? That's another interesting topic. Here's a study that they looked at the biochemistry, what happens after an adjustment in the body. They found out that 3 chemicals that deal with pain change: neurotensin, oxytocin, and cortisol. And all 3 chemicals were elevated with cervical adjustments, neurotensin and oxytocin with thoracic adjustments. So what we're finding is that the chiropractic adjustment actually affects the biochemistry of the body. It's not just relieving skeletal pain. It actually affects chemistry. Here's another study. I love this study. This is from a journal called Brain Structure and Research. And this study, they wanted to find out what happens with the nerves that come out of the upper neck. How do those nerves affect the body? And when you adjust the body, when you adjust that area, what happens? Okay? They said nerves arising from the upper cervical spine influence organ function. Okay? Abnormal stimulation of these muscles, such as a whiplash injury, can cause changes in heart rate and breathing. And you see that with people who've been in car accidents. A lot of times have heart palpitations and all kinds of things, crazy things going on. The upper cervical alignment influences nerve impulses into the brain, which influences the entire autonomic nervous system, homeostasis, and health. Now, do you ever hear of any of these studies on the TV commercials? No, you don't hear about them. Okay? This is what they're talking about. This is the upper cervical area right here. These are the muscles, the upper cervical muscles are talking about. And when this is subluxated, which you see here, misaligned, this kind of misalignment can really change the function of the body. Okay, here's Medical Science Monitor, a little over 2 years ago. This study investigated what happens when an individual loses a cervical curve. Okay, number 1, it causes disruptive biomechanics, triggering degeneration in the neck. Number 2, it causes neck pain, upper thoracic pain, shoulder pain, headaches, and poor health-related quality of life. And number 3, loss of cervical curve causes decreased blood flow to the brain due to changes in the vertebral artery. So let me ask you a question. You know, if you have this going on, and I'll show you the picture of that. This is a normal neck. See, normal cervical curve. This is the front, this is the back. Here's a reverse cervical curve. Okay? So this is, you see the neck's curving backwards. So if we go back to this, where it causes all of these things, tell me what kind of problems an individual might have other than just pain when you have some of this going on. What do you think might happen to a person? And I actually see this in practice a fair amount. People usually don't tell me until it gets better. Anybody?
Are you looking for like migraines or something? Or
That could be one. But what I'm thinking about is balance, proprioception. People tell me, you know, I've had 2 people tell me this recently, you know, I just feel more stable now that I've been under care. I feel more balanced. My oldest patient is 96, and his wife's 93, and they've only been married 4 years. They met in 2nd grade, so that's an interesting story. But anyway, he told me, now he came in because he had shoulder pain and some other things, but he said, you know, I just feel more steady now, more balanced. It's because some of this stuff is getting fixed, okay? Why do older people tend to have more falls? Because they have stuff going on in their neck, okay? That changes their balance, their proprioception. Okay, that's not the only reason they fall, but it's one reason. Okay, now, since you brought it up, chiropractic and migraines, okay? This is from a journal called Complementary Theories in Medicine, 3 years ago. 3 groups of migraine sufferers were divided into 3 groups. One group received chiropractic adjustment and drugs. One group received a sham adjustment and drugs, meaning fake adjustment. One group received drugs only. This study lasted 6 months. After 6 months, here's what they found. The manipulation plus drugs group were able to reduce their drugs by 80%, their migraines reduced by 97%. The sham group, the fake adjustment group, they reduced their drugs by 68%, and their migraines were reduced by 17%. The med-only group had no reduction in medication after 6 months, had a 1% reduction in migraine headaches, and a 0% reduction in functional disability. Now let me ask you a question. What seems kind of odd about this study? Or what seems interesting about it?
The placebo effect.
Yeah. The ones that got the fake adjustment, they did better than the drugs. And what does that mean? That means when you touch somebody and you lay your hands on somebody, that has an effect on healing. Okay? And so the fake adjustment, that worked better than the drugs. You know? And I mean, you don't see this on the pharmaceutical commercials on TV. I'll tell you that. Wow. Now, here's another interesting study. I love this study. They wanted to find out, this is at Tohoku University in Japan, School of Medicine. They wanted to find out, well, what happens to the brain when you adjust somebody? So they did some PET scans of the brain, positron electrotomography. Is that what it is, Roger?
It could be. I just call it PET.
Okay, all right. Roger's a PA, so anything medical I go to him for. So they looked at, so what happens when you adjust somebody? What happens in their brain? Well, first of all, activity in the cingulate cortex was increased. Well, that has to do with learning, emotions, and memory. Then they found out there's increased in the cerebellum, increased activity. That's right back here. And that happens to do with posture, movement, but it's also a big emotional center, big emotional switching center, okay? Then there was the somatosensory cortex. That area was reduced in activity. And that's pain perception and localization. And they also found that salivary amylase was reduced, which is an enzyme which tends to increase with stress. So what they found in this study is that chiropractic affects the brain. Brain function changes when people are adjusted. Now, I want to end with this concept. It's a concept of NNT and NNH. NNT is called number needed to treat. NNH is number needed to harm. How many of you have ever heard of that? Oh, some of you, yeah, good. Okay, so this is really, really important, a really important concept in medical research. Okay, so the NNT, number needed to treat, is a number of people that will have to be treated with a particular therapy to get one individual well or to prevent one occurrence. All right, so basically, how many procedures or how many drugs do you have to give to somebody before one person gets better? That's what the NNT is, okay? So, NNT, number needed to treat, NNH, number needed to harm. So, let's look at the NNT of common pharmaceuticals and procedures. Now, you can find this online, and I have it in the notes, called the NNT.com. Statin drugs, you need 103 people need to take statin drugs over 5 years for one to benefit. Okay, the NNT is 103. Okay? You don't hear that on the pharmaceutical commercial, do you? No.
Better hope you're that one.
Yeah. It's like the lottery, okay? Antibiotics for upper respiratory infection, none were held for infection, 1 in 6 for cough. Coronary bypass surgery for preventing death in 10 years, 1 in 25 were held. Aspirin to prevent heart attack, 1 in 2,000. Okay? So this is stuff, this is a website put up by physicians, by researchers, that people can access. But how many of you ever heard of that website? I know, well, you have, okay. Have you been to this talk before? Oh, but you heard of the website? Oh, that's awesome. Yeah, it's called the NNT.com. So the NNT of chiropractic is estimated to be 1.8 to 2.4, which is pretty low, okay? So here's my question. You know now that scientific, that chiropractic has a pretty solid scientific basis behind it. I like to keep my talks to about a half an hour, otherwise I could have thrown up another 10 or 15 articles easily that I have. But I just threw up some highlights. But the question I have is, who do you know that doesn't know what you know about chiropractic? Because, you may know some people that need what we do. And on the next week, we're having our Patient Appreciation Day on the 17th, where we do free spinal checkups, free subluxation checks. And if you know some people that want to come in and just get checked, I mean, they don't have to be a patient, just get checked. Have them call the office, and we'll do that for them, because you can see that the evidence shows that chiropractic is effective. It's scientific. And if we can get people off drugs and help this community take a few or less drugs, and we're going to benefit the whole community. So that's all I have tonight. Does anybody have any questions? You get everything down in the notes okay?
Pretty much.
Okay. Did I go too fast for the notes? Or?
Well, it is on Facebook, so you can always
I was
watch
gonna
it.
say, I don't write that fast, but I knew she was recording it, so I'll go pick it up later.
Okay, all right.
Yeah. No, it was great.